In digital health, we know that data needs to move safely, quickly, and with purpose so that clinicians have the right information at the right time to make effective care decisions. We're trying to get to a world where information about a patient flows smoothly between the EHR, specialty apps, patient portals, analytics platforms, and devices. In today's video, I want to talk about a pair of complementary standards that's helping to make the data exchange between apps and the EHR possible, which is Smart on FHIR. More specifically, I want to talk about what Smart on FHIR is, why it matters, and how it supports patient care. Before we jump in, if you're new here, I'm Dre, a health IT consultant and founder of the Dragon Network, and if you're returning, then welcome back. Okay, let's start with a quick look at what problem Smart on FHIR is actually trying to solve. Back in the early 2000s, if an app developer wanted their app to work with multiple EHR vendors, like Allscripts, Epic, Cerner, Meditech, etc., they had to work with each vendor independently to follow specific guidelines and interface rules. Sometimes that even meant creating different versions of their app. As you can imagine, this was starting to have an impact on the speed of adopting new and innovative digital tools in clinical environments. So in 2011, HL7 International brought a group of people together to start developing a universal framework that would allow apps to connect and exchange data more easily. That framework is FHIR, which stands for Fast Healthcare Interoperability Resources. The standard focuses on how patient information should be packaged and shared between different systems. It defines standard building blocks or containers of data known as resources for a patient's demographics, medications, allergies, diagnostic results, etc. Because FHIR outlines a structure that is consistent and predictable, other systems know how to respond to it. Kind of like shipping containers. There are a set of standard sizes and shapes that are used to ship goods around the world so any port can load and unload them. Same concept, but with packages of data. Now let's look at the SMART piece. The acronym stands for Substitutable Medical Applications Reusable Technologies, and it focuses on the security around who can access the data and the patient context. It was developed by Boston Children's Hospital and Harvard Medical School with support from ONC. Essentially, SMART answers three questions. Who are you? What are you allowed to see? And what patient are you working with right now? Think of it as a secure key that grants access to the right patient at the right time. When you use them both together, FHIR provides the structured data, and SMART provides secure access and context. So we can safely connect apps to the EHR, and when they're launched, they already have the right patient in context, so they can seamlessly support clinical workflows. For example, if an organization connects a cardiac risk calculator to the EHR using Smart on FHIR, clinicians could launch the calculator from the EHR toolbar so that when it opens up, it's already logged in with the right patient in context. Relevant data such as age, blood pressure, past medical history, and diagnostic results might already be filled in. From the clinician's perspective, it's seamless, and from a health IT perspective, it's a standard-based workflow using predictable data. With most health systems live on an EHR, focusing on digital tools that are Smart on FHIR capable allows organizations to bring innovative apps into their environments faster, because the need for custom interfaces with every single app connection is greatly reduced. This shortens implementation timelines and simplifies the testing activities because the standards clearly outline what is supposed to be expected. From an IT perspective, it usually means less maintenance over time, which is always a good thing. For those of you wondering if Smart on FHIR is going to stick around, and if organizations are really going to embrace this way of connecting apps to the EHR, you'll be happy to hear that the US 21st Century Cures Act requires that certified EHRs must provide FHIR-based APIs that provide secure access for patients, so the FHIR part is covered. We know that global app developers tend to align with US requirements due to the large market opportunity. So FHIR is very fast becoming the standard of choice for apps. Now, SMART is not named in US regulation by title, but there are rules that require secure authentication, controlled access, and the ability to pass patient context, which SMART covers. Since it's clearly defined and it pairs with FHIR very well, many vendors choose to use SMART for these access and context rules. These two standards are a great thing for innovation, and as more apps become Smart on FHIR capable, the EHR becomes less of a single environment and more of a platform that supports choice. Giving organizations the ability to safely and predictably connect apps to their core environments will help give clinicians access to the right information at the right time without disrupting their workflows, and all without overwhelming IT with customized feeds. I hope you found this video helpful, And I'll put a couple links in the description box below so that you can go and read more about Smart on FHIR if you choose to dive a little bit deeper into both of these standards. I will see you again next time.